Good afternoon. As a land-grant institution, we would first like to acknowledge the Gabrielino Tongva peoples as the traditional land caretakers of Tovangar, that is, the Los Angeles Basin and South Channel Islands. Welcome to the 2022 Health Policy Seminar Series at the UCLA Center for Health Policy Research. My name is Todd Hughes, and I'm the director of the California Health Interview Survey. Thank you for joining us for today's webinar, Support at Home, Out of Reach for Many Older Adults and Adults with Disabilities in California. I'm excited to introduce this webinar featuring findings from the California Long-Term Services and Support Study, a follow-on survey of the 2019 and 2020 California Health Interview Surveys. The LTSS study was developed to understand the needs and unmet needs of older adults and adults with disabilities in California. About 14 million adults in the United States need home and community-based services in order to maintain their independence and support their quality of life. As the baby boomer generation ages, and as advances in medicine and technology help people who have multiple chronic conditions and/or disability live longer, this demand is expected to increase dramatically. Today's presenters, Dr. Kathryn Kietzman, Senior Research Scientist and Director of the Health Equity Program here at the UCLA Center for Health Policy Research, and Lei Chen, a graduate student researcher at the center and study co-author, will share findings from their new publications. The first focuses on older adults and adults with disabilities' personal care needs, such as eating, bathing, and getting around inside the home, and routine care needs, which include everyday household chores, grocery shopping, and running errands. Researchers will also highlight some of the negative consequences associated with unmet need, including going without groceries or personal items because of difficulty shopping and making mistakes in taking prescribed medicines. The second publication examines financial hardship among older adults and adults with disabilities, including difficulties paying for housing and medical bills, and cutting down on the amount spent on food and medicine. Presenters will also discuss some significant unmet needs and financial difficulties by race and ethnicities. Next slide. As always, if you would like a PDF copy of today's presentation, please email the Communications Department at healthpolicy@ucla.edu. The webinar is being recorded and will be available on our YouTube channel in the coming weeks. Next slide. Now let's begin today's discussion with my colleague, Dr. Kathryn Kietzman.
Good afternoon, and thank you, Todd, for that introduction. And welcome. Thanks everyone who's joining us today. I'm so pleased to be here today, along with my talented colleague and doctoral student candidate, Lei Chen. It's great to have the opportunity to share some findings from our research that looks at the needs of older adults and adults with disabilities in California, and the gaps in access to essential supports that they may need in order to maintain their independence and quality of life. Before I begin, I would like to gratefully acknowledge the funding support provided by the California Department of Healthcare Services that has enabled us to conduct this study, and also to clarify that the content that we present today does not necessarily represent the views of the Department of Healthcare Services. As Todd mentioned, we have two publications that were released earlier today, and today we're going to share data from this statewide survey conducted in 2019 and 2020 that provides population-level estimates of the need for long-term services and supports in California among older adults and adults with disabilities. While other studies of unmet needs for long-term services and supports, or I might refer to them now as LTSS for short, as those studies have been conducted, most to date represent individuals who are already receiving services, who are already connected to systems of care. Our survey is a little bit unique as it captures a representative general population in California, including individuals who have needs for care but may not be connected to LTSS or other systems of care, or they may be connected to care but are not receiving adequate help with their LTSS needs. And most studies to date have focused either on older adults or younger adults with disability. Our study includes both of these groups. Our survey includes non-institutionalized individuals who may need home and community-based services to maintain their health, safety, and well-being. And specifically, we'll be reporting on what we have found about their unmet needs and the consequences of these unmet needs, including the financial hardships that many of these Californians are experiencing. Later, we'll send you some links to the fact sheets, and at the end of the webinar, we'll post the links as well, so that you can access these study materials. So, as Todd mentioned in the introduction, recent estimates indicate that about 14 million adults in the United States have needs for long-term services and supports. And when we talk about the LTSS needs in California, it's important to look at some population trends by race and ethnicity. While people of all ages have needs for LTSS, these needs typically increase as we age, are more likely to live longer, and with multiple chronic conditions and disability. Now, this graph shows the projected population growth in California by age. You can see that there are sizable increases anticipated in the coming years, particularly in the older age groups of those 75 to 84 years of age, with about 150% increased by about 2040, and nearly a 250% increase in the 85 plus population by 2050. As California's population ages, it's also increasing in its racial and ethnic diversity. The fastest growth in the older adult population will be among older adults of color. As this graph shows, between 2012 and 2030, Black or African American older adults are projected to increase from 5.2 to 5.4% of the older population. Asian and Pacific Islanders from 14.1 to 16.4%, while Latinx older adults are expected to increase from 18.3 to 26.3%. So as California makes plans to advance programs and policies that better serve the needs of older adults and adults with disabilities, attention to cultural and linguistic differences is critically important. So let's just step back for a minute and define LTSS. What exactly are they? So LTSS includes supportive services that address a range of care needs and are provided in a variety of locations in the community, for example, in people's homes or in independent living centers or senior centers, and also in institutional settings, in skilled nursing or assisted living facilities, for example. Examples of formal paid services include personal care services, meals and transportation services, adult day care and case management. However, the bulk of LTSS are provided by family members, friends, neighbors, and pets. Yes, pets, they're a huge source of social support. And these are the unpaid sources of support on which many community dwelling older adults and adults with disabilities rely. So from the viewpoint of LTSS consumers and their families, the formal LTSS are complex. Each program seems to have a different eligibility requirement, a funding source, different points of entry, and different assessment processes. And it's typically the people with the care needs and their family members who are most often left with the task of identifying, coordinating, and managing a very complicated array of services. So why are we focusing on unmet needs and financial challenges? Well, we know that unmet needs are associated with poor health and social outcomes and many other adverse consequences. And we also know that access to supportive services at home and in the community is essential to maintaining physical and mental health and independence. And it's often key to preventing or delaying unnecessary or premature institutionalization. We focus on financial challenges experienced by LTSS consumers because there's currently no public benefit that sufficiently addresses these needs. As a result, people with LTSS needs are at increased financial risk when compared with the general population. For most families, paying privately for LTSS is out of reach, yet out-of-pocket spending is the biggest source of private spending for LTSS. Private long-term care insurance is held by very few. I think the numbers are about 5% here in California. It tends to be expensive, and people have concerns about whether it will maintain its value over time. The largest public payers for LTSS are Medicaid and Medicare. However, Medicare coverage only follows acute care events and hospitalizations. It does not cover ongoing needs for LTSS. Medicaid, known as Medi-Cal in California, provides some coverage, but does not cover all of the services and supports an individual may need. It also comes with an income requirement, so many LTSS consumers do not qualify until they have spent down their personal resources. Unfortunately, this is often the case that the spend down happens because of high medical and supportive care costs. So a little bit about how we collected the data for this study. I'd like to provide this information, how we identified our population of interest. Our survey, as Todd described in the introduction, is designed as a follow-on survey to the California Health Interview Survey, which is the largest population-based state health survey in the United States and provides a representative sample of non-institutionalized Californians, surveying approximately 20,000 households each year. CHIS, as we call it for short, queries a broad range of health topics and health-related topics such as health insurance coverage, health conditions, food insecurity, use of preventive care, housing, use of public benefits, and much more. CHIS uses two modes of data collection, web-based and telephone-based. So for our study, if CHIS respondents answered yes to one of three disability questions, they were invited to participate in the California LTSS follow-on survey. So to develop the content of the survey, we convened a work group that was comprised of a large and diverse group of aging and disability stakeholders. The main objective was to identify priority topics and questions to include in the survey. And we focused on using questions that had already been tested and validated in other national and local surveys. And this would provide opportunities to compare across data sources and to advance our analyses. Our final set of questions were organized into 5 content areas: service needs, consequences of unmet needs, types of and access to services and supports, financial concerns, and consumer experience. The final version of the survey was translated from English into 5 languages: Spanish, Korean, Vietnamese, Mandarin, and Cantonese. And it was administered by web and by phone to adults ages 18 and over. The survey averaged 15 minutes in length and included up to 74 questions. So across the 2019-2020 CHIS cycle, 3,990 respondents were screened and found eligible for the follow-on survey. A total of 2,030 completed the survey and are represented in the data we're presenting today. And so now I'm really happy to turn the presentation over to Lei Chen, who will share information about who completed the survey and what have we found. Lei?
Thank you, Kathryn. Now we will show you several main findings from our 2019 and 2020 LTSS survey. This slide shows how many LTSS survey participants or respondents reported having type of disability. As Kathryn mentioned, we asked 3 screening questions in the CHIS general survey to identify potential participants eligible for the LTSS survey. These 3 questions include: because of a physical, mental, or emotional condition, do you have serious difficulty concentrating, remembering, or making decisions? Do you have any difficulty dressing or bathing? Because of a physical, mental, or emotional condition, do you have difficulty doing errands alone, such as visiting a doctor's office or shopping? If survey participants or respondents responded in affirmative to any of the 3 screening questions, they would be eligible to participate in the following LTSS survey. We asked these 3 questions again in the LTSS survey, and this graph shows how many participants have answered yes to any of these 3 types of disability. Close to 55% respondents reported having serious difficulty concentrating, remembering, or making decisions. More than 35% of respondents reported having difficulty dressing or bathing. More than 50% of respondents reported having difficulty doing errands alone. Next slide, please. Here are demographic characteristics for people who participate in this study. All the numbers are weighted based on California population characteristics. Close to half of respondents are older adults who are 65 years old and above. Half of respondents are white, non-Latinx. Close to 30% respondents are Latinx. 8% are Black or African American. 10% are Asian. 4% are American Indian and Alaska Native or people with 2 or more races. We have more than half of respondents who are female. 3/4 respondents only speak English at home. 14% of respondents live in rural areas, and close to half of respondents live below 200 federal poverty level. Regarding working status, close to 70% of people were not in the labor market. Close to 25% were in labor market, and 8% were unemployed when taking the survey. Next slide, please. After briefly introducing our survey respondents' characteristics, here is what our survey shows about older adults and adults with disabilities' unmet needs for help at home. For these people, more than 1 in 2 reported they need help of another person for routine care, or we call doing errands, such as visiting a doctor's office or shopping. 1 in 5 reported they need help with personal care, such as dressing or bathing. Among those who need help, 2 in 5 reported they could use more help or get no help at all with routine and personal care. Next slide, please. We also examine respondents' needs for help at home with routine or personal care by their race ethnicity. This graph shows that more than 70% of Black African American and people with 2 or more races need help with routine care, which are 2 groups who have the highest need in the routine care need. Close to 40% of Black African American people need help with personal care, which is the group who has the highest number of need in personal care compared with other racial ethnic groups. Next slide, please. In addition to unmet needs for help at home, our results also show several negative consequences as a result of unmet needs reported in the past 1 month before respondents taking the survey. Close to 46% of respondents reported stay at home due to difficulty going outside. Close to 20% of the respondents reported they going out groceries or personal, they going without groceries or personal items due to difficulty shopping. And close to 28% of them said that they made a mistake when taking their medications due to difficulty keeping track of them. Next slide, please. When we look at these negative consequences by respondents' type of disability, we find that people with individual type of disability are more likely to report these negative consequences compared with average number of all respondents. Close to 70% of respondents who have difficulty with personal care needs or routine care needs reported that they had to stay at home because of difficulty going outside in the past 1 month. More than 28% of respondents who have difficulty with personal care needs and more than 26% of respondents who have difficulty with routine care needs reported they going without groceries or personal items because of difficulty shopping in the past 1 month. And more than 35% of respondents have serious difficulty concentrating, remembering, or making decisions, reported that they made mistakes in taking prescribed medicines because of difficulty keeping track. So these are the main findings showing our first fact sheet about unmet needs for help at home. Now we are moving to see what our survey data show about older adults and adults with disabilities struggle to make financial ends meet. In our survey, we asked respondents' perception of financial worries and also 7 types of financial difficulties they experienced in the past year. These financial difficulties are related to housing, medical bills, food, saving for retirement, borrowing money from others, household income decline, cutting spend on prescriptions or medical care. So let's now look at some numbers. Among older adults and adults with disabilities, 3 in 5 said that they were very worried or somewhat worried that their total family income was not enough to meet their living expenses and bills. 2 in 5 said that they had cut back on saving for retirement. Nearly 2 in 5 said that their household incomes declined. And 1 in 5 said that they had debt due to medical bills. Next slide, please. We examined financial difficulties by respondents' demographic characteristics. This slide shows 3 types of financial difficulties by race ethnicity. We can see that more than 40 of Black African American and Latinx respondents reported receiving or borrowing money from someone, which is higher than other racial ethnic groups. More than 55% of Black African American and the people with 2 or more races reported cutting amount spent on food. And more than 20% of Latinx and Asian respondents reported unable to make rent or mortgage payment. Next slide, please. Okay, this slide shows 6 types of financial difficulties by different age groups. So in general, middle-aged adults who are between 45 and 64 years old had much higher chance of reporting several types of financial difficulties than young and old age respondents. These financial difficulties include unable to make rent or mortgage payment, had debt due to medical bills, cut back on saving for retirement, cut down amounts spent on food, and household income decline. However, we also find that more than 44% of young age adults who are between 18 to 44 years old reported receiving borrowing money from someone which is higher than middle and old age group respondents. Next slide, please. So we also examined financial worries by respondents' characteristics in age, income, and employment status. These financial worries refers to people who were very worried or somewhat worried that their total family income was not enough to meet their living expenses and bills. The blue line here shows that in general, more than 60% of respondents reported having financial worries. When we look at age groups, more than 78% of middle-aged respondents reported having financial worries, which is higher than the young and old age groups. People who live under 300% federal poverty level reported having financial worries that is higher than the average number of all respondents. Regarding employment status, 75% of unemployed respondents reported having financial worries. Moreover, close to 70% of respondents who were in the labor market also reported having financial worries. So these are our main findings about unmet needs and financial difficulties using 2019 and 2020 California LTSS survey. In the next few slides, Kathryn will provide some discussions, policy implications, related work, and ongoing efforts about this study. Kathryn, please.
Thank you, Lei, for walking us through those findings. Quite a bit to digest. So at the same time that we know that there's growing demand for LTSS in California, we're finding these very high levels of unmet needs and adverse consequences associated with these unmet needs. And I think these findings underscore the importance and the need to improve access to appropriate and sufficient supports at home, both paid and unpaid supports for older adults and adults with disabilities. And these adverse consequences that we're seeing can aggravate existing difficulties by increasing rates of social isolation, triggering acute health events or crises due to experiences of food insecurity or medication mismanagement, due to social isolation and not being able to access just very basic supplies. Improving access to LTSS also means that these supports need to be affordable. The number and intensity of LTSS consumers' financial hardships and worries suggests the need for a more widely available and robust public benefit for LTSS. So the need for LTSS is an issue that really affects all California households, neighborhoods, and communities. LTSS need to be affordable, accessible, universally available to all who need them. One important step to achieve this goal is to increase consumer knowledge and access to the available supports and services in the community. And we must direct supports to those who are most likely to have unmet needs for assistance, and in particular address inequities experienced by those who are most vulnerable due to the cumulative effects of lack of opportunity and limited access to resources that people experience across the life course. We must do a better job of acknowledging and addressing the social determinants of health that make some groups more vulnerable than others to experience unmet needs and financial hardships, as is demonstrated through many of the findings presented today. So there are some good efforts and good news in California. Under the executive order of Governor Newsom, California is currently implementing a master plan for aging. And this is a 10-year blueprint for state government, local government, private sector, and philanthropy that aims to prepare the state for the coming demographic changes and continue California's leadership in aging, disability, and equity. The goals and strategies that are being advanced through the California's Master Plan for Aging can support both statewide and local efforts to respond to unmet needs for LTSS. Another important part of the solution is to ensure that LTSS are affordable to all who need them. Aging and disability advocates and stakeholders have been working on this issue for some time now, and there are some legislative and administrative efforts underway to find solutions to the issue of affordability. I've posted a couple of links here to examples of some of these efforts. The first is a link to the Long-Term Care Insurance Task Force, and they're exploring the feasibility of developing a statewide insurance program for LTSS. The second is a current legislative proposal that would establish a California LTSS Benefits Trust Fund that would finance LTSS and a board that would manage the revenue for eligible older adults and individuals with disabilities. They're looking at a range of options and the pros and cons of different approaches that could be taken to develop a statewide insurance. And they do have a report that the result of this many months of efforts to review what's available and what might be feasible in California. I believe they have a report that's due in 2023. So in general, advancing policies that make LTSS more affordable and accessible can contribute to improving the health, well-being, the quality of life for these individuals, while also reducing costs borne by states by avoiding unnecessary and costly institutional care. So we do have some related work and ongoing efforts. This survey provides an opportunity to establish baseline measures and analyze population level trends over time as Californians with disabilities continue to age. And the Master Plan for Aging's data dashboard is actually using many of the metrics from the LTSS follow-on survey and from the California Health Interview Survey to establish these baseline measures on key indicators and to measure progress toward the Master Plan goals over time. Other related work, I would be remiss if I did not mention my colleague Lei Chen, who is using these data for her dissertation work, which is exploring in more depth the financial strain that's experienced by adults with needs for LTSS and its relationship to a range of health and well-being outcomes. I'm so delighted that she's taking her dissertation down that path, and I have a chance to sit on her committee as well. And also, we're just launching a large qualitative study that will explore the lived experiences of older adults and adults with disabilities who have needs for LTSS in California. And we intend to build on what we've learned from this survey. We hope that we'll gather information that will give us a deeper understanding. And we anticipate that the participants' stories will really help us understanding what it means to have unmet needs. And also, what are the barriers specific barriers that they experience, and what also importantly are the strategies that they use to have their needs met and to support wellness and continued independence at home and in the community. So this is just the graphic showing the 2019-2020 survey, the current work on the in-person interviews with 100 Californians that we're getting ready to launch. And then gratefully, we have funding from DHCS to repeat the cycle of the follow-on survey again in 2023-2024. So we're very excited about being able to continue this work. It seems to align with growing momentum in California among policymakers, advocates, stakeholders to really get this right and to really take action because we really don't have time to sit back and wait any longer in order to really have a robust network of supports available to an issue that, again, affects all of us, our communities, our households, our immediate family members. Again, here are the fact sheets that were released today. And I think that maybe Tiffany, our communications director, has dropped links in the chat to these as well. Some great infographics that were developed by our communications team that accompany them. And thank you once again for listening to our research about LTSS, and we look forward to your questions. I'm happy to turn this over now to our communications director, Tiffany Lopes, who's going to help facilitate the question and answer period. Thanks, Tiffany.
Thank you, Kathryn and Lei. Good afternoon, everyone. My name is Tiffany Lopes, and I'm the Director of Communications here at the UCLA Center for Health Policy Research. We're going to be going through questions from the audience today, so if you haven't, I encourage you to use the Q&A function in Zoom to ask questions. Let's get started with the first question. Given that each program varies in eligibility, funding, point of entry, and different assessment processes, is there an administrative burden for citizens who need LTSS?
Oh, I would say absolutely yes, with capital YES. There are programs that are trying to streamline this very fragmented system, if you want to call it a system of long-term services and supports. And it is challenging because there are a lot of good programs, but they're sort of piecemeal. And how does an average consumer know where to begin to find them? So there's aging and disability resource centers that aim to streamline and become sort of a one-stop shop to get information and to get connected to services that will help hopefully reduce some of the burden of finding the services. That doesn't quite address the having to apply for different services. There have been efforts in the past to come up with sort of a universal assessment tool, so that one tool, one stop for getting information would be ideal. I don't think we're there yet, but there's definitely awareness that this is a big problem. And there are efforts to moving forward to try to integrate and streamline access and reduce the administrative burdens to consumers. And thank you for raising that really important question.
Thank you, Kathryn. Did the LTSS collect information about sources of support? If so, what types of support were included?
Yes, that's one of our topic areas. We asked, and first I should step back and let the audience know that of our surveyed population for the follow-on, only 18% reported that they were using paid services. So this is, again, this is the outcome of doing a population level survey. We do have a large part of the sample that are not receiving services or paid services. Doesn't mean they're not receiving those family supports, because as I mentioned, that's where most of the care and support comes from. But the types of services we asked about a full range of case management services, housing assistance, employment assistance, adult day health care use, program also more recently called community-based adult services, in-home care. We didn't ask using program names because we described the type of program, because not all consumers know what the program's formal names are. They just know that center down the street is a place where I go and I can get physical therapy, or I can join a social support group, or they help me get meals, and that sort of thing. So it was a full range, nutrition programs, mental health, and I'm sure there are others on the list. So we did ask that question, and we'll be providing future reports on some of the outcomes from that.
Great, thank you. Has your research identified the reasons Black and African American people are disproportionately affected by the lack of services needed for a decent quality of life?
That's a big and important question. I don't think we have the depth of data needed to answer that. I think what our data is showing is that there are these disparities, unfortunate disparities. And, we can look at the literature to understand that there are disparate health experiences of adverse health across different population groups. And there may be less connection in under-resourced communities to services and programs that might better support one's needs. I think there are many layers to I could speculate on the answer to that question, but I think in terms of what our data can tell us, it can tell us that there are differences, and we are committed to getting beyond just documenting disparities and really looking for the opportunities to redress and to respond to those disparities and move the needle on these discrepancies or differences we see from one population to the next.
Thank you. Findings for 45 to 64-year-old age group are daunting. If I understand it correctly, could you say more about how you ended up with more than 50% of survey participants being under age 65? As a follow-up, could you say more about how that may or may not have skewed overall results?
Okay, can you read the first part again to me, please?
Of course. If I understood it correctly, could you say more about how you ended up with more than 50% of survey participants being under age 65?
Okay. Yeah, it's a survey that was available to the 18 plus population. The breakdown, I think, is somewhat could be related to the modality of the survey. The California Health Interview Survey, as I said, it's administered both by web and by phone. We have a much larger share of web participants in the California Health Interview Survey, and this is the same modality that we used for the follow-on survey. So we may have a larger share of younger respondents because of that. That's one factor that may contribute. And then the second half of that?
Could you say more about how that may or may not have skewed overall results?
I don't know that it skews overall results because we're able to look at these groups within their different age categories. And I think that the descriptive data that we're presenting today it's still representative. We have weighted survey results that are representative of the larger population of California. So that helps to account for some of these differences in the representation of actual survey respondents.
Thank you. And as a follow-up to that follow-up, somebody says, it's interesting that the mid-range group is the most worried about being able to afford care in the future, more than the current group of oldest adults. What steps can this group be taking now to ensure they can afford to stay at home?
Yeah, I think that is a really striking finding. We noted that as well, that middle 45 to 64-year-old group having more concerns financially. I think that, I mentioned long-term care insurance, but there's not a lot of uptake of that, maybe not a lot of confidence in that as a product. I'll point back to some of the work that's being done to develop a public benefit. I think that in terms of at the individual level, what folks can do, it's going to depend a lot on what types of benefits may or may not be available through employer-based care. As I mentioned, long-term services and supports are just not routinely covered, even through private insurance. This is something that we really have a big gap with. There's a big void in what is available to folks. If you're employed and you have ways that you can have a health savings account, if there are ways you can put away savings, but this is out of reach, as I mentioned, for the majority of people. The types of, the amount of resources that are needed to have ongoing care needs met can be quite formidable.
Thank you. We have a couple of questions about caregiving, and I'm finding the publications to be able to help you respond to those questions. But the first one is there a big enough workforce of home care workers for the future?
Unfortunately, no. And this has been an issue for some years, and it's just unfortunately gotten worse in recent years. We have a real shortage of people who are available for the growing demand for home care work. It's a largely undervalued profession, low paid, and most home care doesn't have a lot of opportunities for stepping up a career ladder. So there's a lot of work that needs to be done to grow our workforce that can provide the types of long-term services and supports we're talking about. I didn't mention that in the presentation, but it's absolutely a major factor that contributes to unmet need. So there was a healthcare commission, a larger healthcare commission report a couple of years ago that California took, brought together a number of stakeholders across different range of population groups, and this was part of that was looking at older adults and unmet workforce capacity, sort of low workforce capacity. So we have a lot of work to do.
Thank you. And then what data is there for family caregivers and their needs? I say this with a smile because I have the links all ready to go, but if you can just talk about it a little bit.
Sure. So in the larger California Health Interview Survey in 2019 and 2020, there was a module that was specifically about, addressed for family and friend caregivers. So if you look to data from that year, we actually have a policy brief we released towards the end of last year, I believe, 2021, that provides a good amount of information about caregivers, informal family caregivers in California, and about their experiences, their financial stresses, the amount of hours they provide care to their loved ones, the extent to which their caregiving affects their employment. We had a pretty shocking number that from that report where only 1% of family caregivers were actually accessing paid family leave, and which is a policy and a program that can help, but it's not accessible for everyone because it's just not sufficient for a lot of folks who have lower incomes. If it's 60 or 70% of the income is replaced, that's not tenable for a lot of folks. But just the fact that such a small percentage is using it, the largest proportion of that benefit is actually used for for childbirth and for early time at home with the baby. We've got a lot of room for growth in getting the word out about paid family leave for families who are helping older adults and other adults with disabilities. But I think Tiffany will point you to the policy brief that we released several months ago.
Yeah, I just dropped the links to the publication page, the policy brief, and the infographic in the chat for those who are interested in looking at it. We are in a crisis of overburdened resources and underfunded social services that was predicted when the size of the boomer generation became apparent. How can more academic research overcome the barriers to creating a social structure that doesn't simply discard those who are not considered productive?
Well, I think that, where can the academics contribute? Is that sort of the core of the question there?
Yes.
Yeah. I think that, our work is to get the evidence, to put out the evidence about where there are disparities, where the needs are, where are we falling short in terms of service delivery, program availability, workforce, et cetera. And to translate, and this is largely what we try to do here at the Center for Health Policy Research, is really just to translate this information and get it in the hands of people who can bring it to policymakers, to decision makers, who are in a position to perhaps move some efforts forward. And I appreciate, the lead up to that question. This is something that's been going on for some time. Some people might say that we need more of a social movement, to get things moving. Again, I do take some comfort and some optimism from recent events in the state of California, in particular, with this master plan and with increasing efforts to take action and address some of these huge gaps we have.
Definitely. How did you decide to use only 3 of the 6 ACS questions on disability status?
Only 3. Well, from a functional point of view, there's sort of there's definitely limitations in using those 3. I mean, I certainly acknowledge that. In terms of having a screening process that's not burdensome, having something that's streamlined, and then being able to focus our follow-on sample accordingly. We did work with the stakeholder group, as I mentioned earlier, in deciding, how to screen, what questions we should ask. And so it was really the input of that group that where we reviewed available questions, had to scale down. I mean, there's a financial cost to all the questions that we ask. And so we're operating within a budget. So there's some financial restrictions in how many questions we could actually fund in order to get this follow-on sample.
Thank you. Is there any type of resource guide available for family and caregivers of older adults and disabled people that they can turn to assist in finding services, assistance, and support? And I'll let you answer that question in a second, but I do encourage, folks who know some of those resources, if you can drop them in the chat, I think it'd be really helpful for people. It's a question we've gotten a couple of times today.
Yeah.
So, if you do have any resources that you know of, please go ahead and drop them in the chat.
That would be great. Well, I'll say that California, as all states, have what are called area agencies on aging, which are a go-to source to learn about programs and services. They serve the 60+ population, and they do have an information assistance hotlines and so forth. Again, I mentioned earlier the Aging and Disability Resource Centers, which are really working to provide exactly that, resources, a go-to, a one-stop place where you can go and get information about what might be available. I mean, that said, those are two that come to my mind. There's a federal elder care locator number that is sort of a hotline. There's a benefits checkup. I mean, part of the complexity is also, as I mentioned before, and someone raised a question about, is the administrative complexity and knowing what you're eligible for. So there's a national program, benefits checkup. It's an online tool. You can go on and put in details about you or the person that you assist and find out if they may qualify for certain programs. So that might be helpful. Those might be some helpful first steps to take. Area agencies on aging, they have again, they're located they represent all counties in California. So it helps because it's the local network, and by contacting the local network, you're more likely to get in touch with those things that are available to you in your community.
Thank you. What can we as a nonprofit health center program do to direct our older adult population to care? It was mentioned that there is no singular tool to shop for LTSS.
As a nonprofit organization, I would also encourage you to connect with the Area Agency on Aging to get some of that information and some of those connections, and or to the Aging and Disability Resource Centers who can help with that. Some programs come up organically, or some supports also come up organically in communities, and sometimes that's a better strategy, especially for reaching people that are not necessarily big fans of governmental programs. So there are also, supports and information through churches and that can be helpful and also just more accessible to folks. I think that, having a trusted messenger helps open the doors to, to folks who may be reluctant or, not sure if they really want to go and, share their personal information with an agency. So that word of mouth and those local connections can be very important pathways to accessing information and then also services and supports.
Thank you. Somebody did ask if you can share the link to that benefit checkup page.
Yeah, I can look for it. I don't have it right here, but I can look for it while we're talking.
Sounds good. If that person does want to email us at healthpolicy@ucla.edu, we can get that to you after the webinar is over as well. We have a couple more questions, so if anybody does have questions, if you can just drop them into the Q&A, we'll be wrapping up in about 7 or 8 minutes. Are people open to using robots or other AI when it's so hard to find people caregivers?
I think it's probably a very individual level issue. You know, I know that other countries are quite advanced. Some other countries are really advanced with using robots for home care. And it's certainly something that I think we need to take advantage of all technologies we can, but at the end of the day, I think it becomes a conversation for the person who needs the care, their level of comfort with using that type of technology, and balancing that sort of, I guess the critique might be the impersonal piece of it. But you know, we are as a society moving towards driverless cars, and it is a trend that as we are aging, it may become more acceptable. It might be more preferred by people who are now in their 45 to 64, and maybe when they age, they're going to prefer to have a robot. Not everybody gets along with family members, and I say that tongue in cheek, but you know, sometimes the need to have your needs met can certainly override other considerations. I think it's going to really vary depending on the individual's preferences, and I think that's key, is understanding and listening to a person who has needs, and what is the pathway that they want to take, and would that be a pathway that they would consider?
Thank you, Kathryn. What can we do as individuals to show our support for proposed policies? How do we find out about proposed policies? I also am busy caregiving.
Yeah, this is why it's hard to get caregivers organized to create a social movement, because caregivers are just too busy taking care of family members. There have been efforts to do that sort of thing, to have campaigns, and I think that there are caregiver resource centers here in California that might be instrumental, and certainly they're designed to be supportive of caregivers. But the larger question, I think, is as a individual citizen, resident, California, you know, how do you get involved? I would suggest that you look for the advocates in your community who are concerned about health and well-being of its community members, and that there are pathways from those connections that can connect you to groups that are organized to bring concerns to the legislature, whether it's the state level or the federal level, and get involved with some of those local efforts, and maybe it'll bubble up to, you know, a higher level. But I think there needs to be you know, there needs to be a lot of people coming together, sort of demanding the changes and the systems, the better systems of care that we all will benefit from, our family members will benefit from. And I think people are starting to get it. It always, people get it when it touches their family, especially. It becomes more personal, and people realize, and certainly I think going through COVID has exposed a lot of the deficits of our systems of care, and hopefully now that we're gradually getting back out and meeting and greeting each other, there'll be increased opportunities at the community level to build up these coalitions and to work collectively. But you know, log into the master plan for aging, and I want to emphasize that that's really that process. I've been involved with the subcommittee, the research subcommittee for the master plan, and they really are working hard to address the needs of older adults and adults with disabilities. The name disability is not in the master plan, but the connection and the commitment to the disability community is integrated throughout. So I just wanted to make that point for the audience. And I think there are a lot of opportunities through that master plan, because there are local implementation opportunities that people can get involved with to identify what the needs are in their communities for their families. And that can lead to, you know, to having your voice heard. And of course, you can always go knock and send emails and such to your representatives.
Thank you. And then somebody dropped the benefits checkup link in the chat, so you don't have to worry about finding.
Great. I'm not a multitasker, so I have it here on my phone. I was going to type it, but I was too busy talking.
That's great. And then I just, I want to get a sense from Lei. She's been working as a graduate student researcher at the center and working on these research projects. How has that been for you? And how did you become interested in working on older adult and adult with disabilities research?
Yeah, thank you, Tiffany. And I think the reason I want to know this topic is I really care about my parents, and I want to know how I can take care of them in the future. So, and I think older adults, sometimes, especially my grandparents, they have wisdom and also they need help. So I want to know more about this group of people and their needs and help them address the unmet needs. And the data, I'm interested in the data analysis. So it's really exciting to know there is this population level data set in California can represent several information for older adults and the people with disabilities. And these findings, as you can see, can show some pattern. We can think about how policy work can apply based on this research findings. And also these survey findings will inform, and our today's questions from the audience help us to think about our next stage, the qualitative study. And a lot of great questions the barriers and the strategies. And we want to know from people with LTSS needs, their perception and their experience. So thank you very much for all your questions. It's really helpful for us to think about our future stage.
Thank you so much, Lei. I really appreciate it. And I think I can speak for everyone here. We're very excited to hear about the findings from the qualitative research at some point soon. So those are all the questions we have time for today. I just wanted to thank everyone again for attending this month's webinar. We're going to be posting the recording of this webinar online with closed captions within the next 2 weeks. You can visit healthpolicy.ucla.edu/seminars for that. If you'd like a copy of today's presentation, you can also email us at healthpolicy@ucla.edu. Thank you so much for attending and have a wonderful rest of the day.